Hi, Dr. Wallach.
Hi.
Thank you for taking my call.
Yes, ma'am. How can we help you?
I have a friend that 6 months ago, they removed her thyroid gland, and she had cancer on it, and she also refused to have radiation. She also doesn't have her gallbladder, and she's type 2 diabetes. She's going through menopause, and she complains a lot about her neck and back pain. And she wants to know also if the pain on her neck is because of the thyroid, that they removed her thyroid.
Probably not, okay? But she has a lot of stuff here. How much does she weigh?
158 pounds, and she's 5'2". She's 46 years old.
Okay, 5'2". Okay. All right, Charmaine, what's going on here? This friend of Teresa's, she has her thyroid up because of thyroid cancer. Okay, she has had her gallbladder removed, probably because of pain on her right side. She has type 2 diabetes. She's got musculoskeletal stuff, okay, in her neck and back. What's her underlying problem here?
She's got a gluten intolerance, and she's not able to absorb nutrients, what little there is in the food.
Okay, there you go. And so what would you do for her to support her immune system, which is your best friend, when you have cancer, history of cancer? And what would you do for to support healthy blood sugar, healthy maintenance repair, cartilage, ligaments, tendons, connective tissue? We got a gallbladder missing. And what would you do for her immune system to, help her? I would not give her any thyroid stuff. Okay, it'll be enough in the basic program for maintenance, but I wouldn't give her any more to push the thyroid, okay, because of the history of cancer in it. Okay, so what would you do for her diet-wise and also supplement program?
I would get her on a gluten-free diet, obviously, and none of the bad stuff, no oils, no burnt animal fat, no meats, no deli meats. And then I would get her on 2 healthy brain and heart packs.
Okay.
I would get her on some glucogel. I would get her on some sweeties. And I would get her on some ultimate enzymes. And then some,
because that's our gallbladder in a bottle, and it has the bile in it.
And then some vitamin D3.
Okay, excellent. Vitamin D3. Yep. And so also some. What would you do for maintenance, repair, cartilage, and ligaments in addition to the 2 healthy brain and heart packs?
I said glucogel. Some
glucogel. Yes, ma'am. Okay, get 2 bottles of glucogel, 15 of those a day. Vitamin D3, 3 of those twice a day. And what would you do in addition to getting rid of the fried foods and the processed meats and the oils and the glutens, wheat, butter, and oat? When people have a thyroid problem, there's another thing you need to remove out of the diet. What class of nutrients would you get out of the diet?
No cruciferous vegetables.
Very good. No cruciferous vegetables, no cabbage, broccoli, cauliflower, Brussels sprouts, or kale, because they interfere with thyroid function. And may even, if you eat a lot of that stuff, who knows? And so just stay away from it completely, and that's going to quiet things down also. But Shar is exactly right. It's imperative that she and everybody in the household get rid of the fried foods, the processed meats, the oils, the glutens, and cruciferous vegetables. The sweeties, at her body weight, I'd have her take 2 bottles a month of the sweeties, so she can take 3 of those twice a day. If she's on medication, which she probably is, she needs to check her fasting blood sugar every morning, and as her blood sugar drops, and it will, she needs to reduce her medication as her doctor has taught her to do. Okay? And let's see here. I think that's where we want to go with all that. And I would have her take 1 or 2 of those ultimate enzymes, say 2 minutes before each meal, a couple ounces of water, and so that the enzymes are waiting for the food down in the stomach, and also that bile, ox bile that's in there, is going to help her absorb good fats and also help her absorb the fat soluble vitamins A, D, E, and K. And so you need that bile, and if they've taken out her gallbladder, who knows what's going on in there. But usually that's because of a gluten problem. The ascending colon, the transverse colon, and the descending colon are painful when you have gluten problems in there. And the only thing doctors do, they scratch your head, well, you got pain under your ribs on the right side, we'll take your gallbladder out. And 99% of the time that doesn't solve the problem, because the gallbladder doesn't create gallstones. It's the liver that does that. The gallbladder is just an innocent bag.